Hello, everyone. As you all know, I'm Dr. Marty Ross, and tonight's another one of our conversations with Marty Ross MD. So in the webinar, we're going to discuss your questions. And the way to get your question to me is I'm using the chat box as the place that you write your questions. And so since I've taken it over for people writing questions, I'm going to request that you don't use it to chat with each other either, okay? Because if you put things into the chat box, then it's going to disturb my flow of looking at people's questions. So I'd appreciate that. And it looks like we have maybe about 20 people here tonight, maybe not even that many yet. I anticipate we'll get more as the evening goes on. But if it stays a small number, we'll either get done more quickly or you get to ask me a lot more questions per person. So we'll see how that all goes. As usual, I am creating a recording of tonight's webinar. And if everything goes as planned, I should have that posted in the what's called the Zoom recording section of Lyme United. You can see it if you go over to the left-hand navigation menu in Lyme United. You'll see it under Zoom recordings. I will post that tomorrow morning along with a summary of the recording as well too. Okay. All right. So without any further ado, let's go ahead and get started with the first question. And if you all want to follow along with the questions, you can look at the chat box because I'm pretty much going to take these in the order that they were asked. And so you can follow along as I read them out loud then too, okay? I think that's all the background information I have for you. So anyhow, let's go and get started here. So hello, Colleen, you're here to hound me again. I can see that. So Colleen's been asking me a question about vitamin D and K2 for the last couple of weeks, and I keep telling her I don't know, but I have looked into it. So tonight I have looked into it, Colleen. So Colleen wants to know about what is the best dosage of K2 to take with 5,000 IUs of vitamin D? Is there a particular form of K2 that should be taken? I was told vitamin K2 prevents calcium from being deposited along the walls of your blood vessels and directs it to the bone instead. For 3 months, I've taken 45 micrograms K2 plus trans minoquinoline 7 alongside 5,000 IUD. My D was previously low. I was experiencing hair loss, but now blood work says D levels are 51. All right. So basically, vitamin D and a form of vitamin K, which is vitamin K2, are good for bone health. There is also some science that shows that they may support blood vessel health as well too. Now, there's also another type of vitamin K called vitamin K1, and vitamin K1 is actually used by the liver to make blood clotting factors. So usually when you're seeing vitamin D paired with vitamin K in a supplement, it's the K2 version, and the K2 version has effect in the bone marrow of helping to support calcium deposition and calcium staying in the bones. Vitamin D helps with calcium absorption and therefore getting deposited in the bone. So they're both really good for bone health. The science is not as strong about the combination being as good for vascular health, but people use it that way as well too. Generally, when you're looking at a product, Colleen, they've done a good job of pairing the amount of K2 that should go with the vitamin D, and that looks like a reasonable amount that you're getting along with your 5,000 IUs of vitamin D. That looks reasonable to me. And yeah, in terms of vitamin D, everyone, vitamin D is increasingly being recognized as though it's almost a super hormone in a sense, even though it's a vitamin. And it does a good job of supporting all the major hormonal systems in the body. Increasingly, we're finding it important for immune system function as well, too. What is interesting, well, the functional medicine community has kind of coalesced around the idea of how important it is for every hormonal system to work correctly and for your immune system to work well. At the same time, we've had position papers put out by the conventional medicine community over this last year saying we should stop worrying about vitamin D and don't even check it. So if you're going to your physicians and asking them to check vitamin D, if they're not coming from the world of functional medicine and chronic infections or chronic illnesses, they may just not be familiar with the other science saying that, yeah, there's reasons to look at it. And most of us find from an infection management standpoint, immune health standpoint, trying to get a level of your vitamin D somewhere around 40 to 80, closer to 80 if you can, is probably the most beneficial. Okay. All right. So Colleen, that's what I got for you there. Do you have any follow-up question to that at all?
This is hilarious because I did not expect it. And I thought you were going to say, oh, I was too busy or something. Thank you so much for looking into it. Is there like an ideal, like a level of K2 that would be detrimental if you had too much?
That's a good question. I don't know, because I don't know that we actually have the ability to check vitamin K2 levels. I know we do vitamin D, but I don't know that there's actually a test where you check K2 levels.
Okay. All right. Thank you so much.
Yeah, good luck.
Bye.
All right, let's see here. All right. Hi, Tracy. So Tracy says, hi, Marty. Our family member's doctor has ordered a Galaxy Direct test for Bartonella and an Igenix Babesia fish test. We've been planning a trial of withdrawal of antimicrobial herbs to see if what happens can help us determine if tick-borne infection reactivation is actually the problem. And we're thinking it might be best to withdraw the antimicrobial herbs prior to these tests to avoid suppressing germ load and increase the chance of capturing germs with the testing. How many days after withdrawing antimicrobials do you think we should wait before running the test? Okay, so I want to unpack some things. I'm going to answer your question, Tracy, but let me unpack some things here first. So everyone, in the world of testing, we can describe what are known as direct tests, where you have some way of actually seeing the germ or the germ load. And then there are indirect tests. Indirect tests would be tests that see if your immune system has reacted against the germ, but they don't actually measure germ parts or see germ parts under the microscope. Okay. So for instance, the immunoblot test from Igenix that many of you know, I believe strongly in, is probably the best way of testing for evidence of having these tick-borne infections. That is an antibody test. The immunoblot is looking to see, has your immune system made antibodies against certain proteins found on the covering of the germ, okay? And another type of indirect test would be something called an ELISpot test, which is run by a company called Armin Labs or is run by a company called Infectolab. And what an ELISpot test is doing is looking to see, are your T white blood cells, the type of white blood cells that fight tick-borne infection and fight viruses, are they turned on to fight tick-borne infections? And the only way they get turned on is if they've fought the tick-borne infection, if they've seen it, okay? So those are indirect tests, okay? Direct test would be a culture where you actually see, you draw blood, you put it on a petri dish and you grow the germs. Or another form of a direct test would be to see if you can detect the DNA of the germ using a method called PCR testing, okay? Or another direct method would be to take a marker that attaches to the genetic material of a germ and then see if you can see the germ under the microscope, okay? So the Babesia fish test is a test that uses a fluorescent marker that attaches to the DNA of the Babesia germ, and it lights it up, it fluoresces, okay? So it makes it easier when you're looking under the microscope to see it. The Galaxy test for Bartonella is a PCR test, which is using this method called PCR to amplify the amount of DNA in your blood sample to see if some of that DNA might be from Bartonella, okay? Now, when it comes to testing, there's two things there's one big thing we look at. It's called sensitivity. What is the ability of the test to find that germ in you if it's there? That's called sensitivity, okay? Generally, the Igenix method, the immunoblot method for Igenix, is about 95% sensitive, meaning if the infection is in you, the immunoblot will find it 95% of the time. All right. The ELISpot testing probably is about 80% or less, and these are based on some looser studies. The problem with the ELISpot testing is it's done by Infectolab. and it's done by Armin Labs, is they're not testing for enough strains of Bartonella or enough strains of Babesia or enough strains of Borrelia. So they're missing a lot of it. Okay, they're missing a lot of those infections. Okay, all right. And then with the Galaxy PCR direct test and the Babesia fish test, part of the problem with those, there's a couple. So when it comes to Babesia, we think that Babesia is only shed into the, I'm sorry, when it comes to Bartonella, there are some studies that show that Bartonella only sheds itself into the blood where you can measure its DNA about 10% of the time. Or in other words, Bartonella does not readily live in the blood. So when you're sticking your needle in your arm, the problem with a Galaxy test is Bartonella so rarely lives in the blood that when you stick a needle in, it may not be swimming by the needle when it's drawn. So the Bartonella PCR test may have a low sensitivity. And in fact, Galaxy and other labs have never determined what their sensitivity is because they can't really measure it. They just don't know. Okay. On the other hand, with the direct test, because when they're positive, it really means you're seeing something. When it's positive, it really is positive. Okay. So the best you could say about the Galaxy test, or the best you could say about this Babesia fish test, is that when it is positive, it means something. When it is negative, though, it does not prove you don't have the infection. All right. So I just want you to be clear about that because I know you all hear me talking more about the immunoblot. And the reason I recommend the IGeneX immunoblot so strongly for most people is it is the most sensitive method that we have out there. Okay. All right. Now back to your test question here. So with direct test, you want to give yourself the best chance of having the most germ load in the blood. All right. So you don't want to be killing your germs before you go ahead and do the testing. By comparison, actually, believe it or not, your immunoblots and your ELISpot test will do better if you're on antibiotics at the time of the test. We call that a provoke test, but you do not want to do it with a direct test. All right. So generally, Tracy, so this I had to give a long response to your question because I want to make sure everyone understands what direct and indirect testing means and sensitivity means. But most of us, I think, are recommending about 3 to 4 weeks off of antibiotics or herbal antibiotics before you do a direct test method. Okay. All right. So Tracy, I think that answers your question, but did you have any other comments at all?
That was very helpful. I'm surprised that it's that length of time because I thought that Babesia and Bart kind of rally quickly.
True. I would say we probably don't know the optimum time to be off antibiotics, but I think most of us probably it isn't just that you want to stop killing, you want to get a good germ load back.
Yeah.
So, right, because again, this stuff just doesn't live in the blood that easily. So you want to really get a good germ load before you go ahead and test. So 3 to 4 weeks is kind of an agreed upon number, I think, that most of us have.
Okay, I'm really glad I asked because I had like a few days in my mind, but that makes sense to be more, yeah. And then yeah, we've done the IGeneX tests, and because this is a question of reactivation, we're really trying to see, you know, this kid reactivation of symptoms came after COVID. We're just trying to sort of get some kind of differential diagnosis going here.
I get it. I get it. So again, the whole thing though is the only way that it proves activation is if it's positive. If the testing is negative, it does not prove that you don't have reactivation.
Right. I know. I know.
Okay. All right.
Okay. Thanks for that. So helpful.
Yeah. Good luck. All right. Let's see. Emily says, hi, Dr. Ross. Hello, Emily. Let's see here. Tracy wants to know if I have any insights to share from the conference. So what I would say is no, not a lot. So let me try to round that out a little bit. So sometimes when I go to these ILAD conferences, I will come back with new ideas that change how I might approach a condition like Bartonella or I don't know, mitochondria dysfunction. I learn new ideas about treatment. And I would say this conference did not do that. All right. But there was a lot of, it was still an interesting conference in that there was a lot of discussions about testing. And I'll share what some of those discussions were in just a minute. Some of the new science behind testing and work on trying to get better testing. Okay. So there was a lot of scientific research presented in the testing realm about how do we get testing that is better and about some of the approvals of some new tests. And I'll share that with you here in just a second. Okay. The second big thing that there was a lot of focus on in this conference was showing basic laboratory experiment and research that has been done on different germs other than tick-borne infections that may give us some insights about what to do for tick-borne infections. So for instance, there was so the problem with a lot of these experiments is even though they may show promise, even if whatever they're doing in the lab would be shown to have benefit, it would be about another 10, 15, 20 years before we actually see it being put to work for people with Lyme. All right. As an example, there was fascinating research on biofilms and the way that some of the mechanisms that biofilms have to prevent themselves from being broken down. And the research was being done on staph infections. And one of the things that they've been able to do with some of those biofilms is to actually develop monoclonal antibodies against the biofilm. And then once the antibodies help to start breaking down the biofilm, that allows germs to be released from the biofilm. And when germs get released from a biofilm, they're much more easier to kill. They're kind of in a stunned state. And so they're easier to get killed. So yeah, we'll have to see how this research plays out in the world of staph and whether it can someday be applied in the world of biofilms in Lyme, for instance. Okay. On the testing front, there's some fascinating things that isn't going to change anything for the average person, but some fascinating things. So first of all, IGeneX, as you all know, is an independent lab. And whenever independent labs have a testing method that they develop themselves and they use only in-house, they do not have to get FDA approval. All right. And as many of you know, that's why when you get IGeneX test results, a lot of doctors say they don't buy it because it's quote unquote not FDA approved. Well, IGeneX has taken their testing technique and decided to start putting it into a test kit that other labs can purchase and start running in-house, like LabCorp could purchase it or Quest Diagnostics could purchase it. And so they had to get approval. And guess what? They got approval. So they have a test method for their IgG immunobot for Borrelia, just for Borrelia. It's not for Babesia and Bartonella. But their IgG immunobot now is approved by the FDA, and it is a one-step test, meaning FDA and CDC had only been approving kits that had test 1 and test 2 are called a two-step test. Step 1 was something called an ELISA, and if you were positive on that, then you would proceed to getting a Western blot done. So until this time, the only type of lab that had been approved for actually diagnosing Lyme was this two-step test. And the trouble with the two-step test is, and there's a number of trouble, but you had to get through the ELISA first. And the ELISA was only good at finding Lyme about 50% of the time. All right, so that's why that test was horrible. But IGeneX has the first approved one-step test kit. Okay, it's for IgG. They anticipate later this year that they will have approval on their IgM kit as well too. So first of all, it's the first one-step approved kit. And as a result of that getting approved, the CDC now has changed its website. So it no longer says a requirement to diagnose of a two-step test. It says of a test approved by the FDA. All right, so that's because of IGeneX is having their in there, right? Secondly, as many of you know, the bands that have been used by IGeneX on their Western blot and immunoblot in terms of diagnosing are different than the bands that are used on the CDC and FDA approved Western blots that are out there. So for instance, if you look at an IgG immunoblot, you will see that that you are positive if you have reaction against band 2325, band 31, band 34, band 39, 41, or 8393. If you're positive against 206 of those, that's a positive test, all right? And specifically years ago, using this band 31 and 34 back in the late 80s, even considering using those, were removed from the CDC and the FDA Western blots because they one of those bands was being used in the new vaccine at that time, and they didn't want it to confuse the outcomes. But the 31 and 34 are some of the most sensitive and accurate bands in determining Borrelia. So for the first time, with this IGeneX approval of their one-step kit, they approved the use of 31 and 34 as diagnostic criterion. So it doesn't change anything for your world, everyone, but I got to tell you, this is huge. In the world of testing, this is huge that they wound up going for a one-step kit and they've included band 31 and 34. All right. So we think it bodes well for IGeneX eventually getting approval for some of their other immunoblot methods. All right. All right. And then one other thing that I learned, and this wasn't in a presentation, this was after going ahead and talking to IGeneX a little bit more at their vendor stand. So many of you may be familiar, there's a new test kit out there called AccuDart, which is an in-home test that gives you a yes, no answer as to whether you might have Lyme. So AccuDart is actually run by IGeneX, all right? And this new IDART test that I was just telling you about that's going to be sold by using the IGeneX immunoblot method being sold to other labs, that's also an IGeneX test. So IGeneX now has IGeneX in-house, and then for their more commercial products, they now have this AccuDart, which is the finger stick home test for Borrelia, and they have IDART, which is their test kits that are going to be sold commercially to other labs. Okay, so IGeneX is kind of splintering a little bit. So on their AccuDart, you don't need a prescription. You just get the kit, you stick your finger, get some drops of blood, you collect them, you send them off to the lab, and in about, I think it's a 1 to 2 week turnaround, you get a test result back from them. It does not report bands. It just says whether it's reactive, and they're looking for either IgM or IgG antibodies, all right? So the sensitivity of that test is 83%. And that was the one thing I was trying to get clarification, because some of their original literature was saying it was 95% sensitive, meaning it could find infection if you had it 95% of the time. Well, that's not true. It will find it 83% of the time. And I've been after them for a while to clarify that, because I couldn't imagine it was 95%. So it's 83%. But for a home screening method, you've got an 83% chance of finding it. So that's not a bad thing either. Okay. All right. So, and then finally, there was this new Lyme-seq test that is an antibody test that is about 93% accurate. And Dr. Holly Ahern, I'm not going to go into it now, but Dr. Holly Ahern explained her new test to us maybe about 3 months ago here. And you can find a recording of that in the Zoom room about this new method from Holly as well too. Okay, so those are so it was more of a scientific meeting. I can't say, other than the testing approvals, that we have any big news that's going to practically affect any of you out of this meeting. So Tracy, I see your hand up there. I'm going to ask you, actually turn your camera on so we can see you if you're going to ask a question. That way, if you don't mind doing that, Tracy.
I'm not in the best situation.
All right, that's fine.
Today.
That's fine. All right, I got it. Yeah.
But you know what I look like. You remember me.
True. That's true.
So I just think that's so exciting, actually. And does that mean that now people, when they go to Quest or LabCorp, can get this test?
It's not there yet, but
Okay.
now it's up to IGeneX to convince these labs to start buying their test. And some of that is going to be predicated on the ability of IGeneX to get insurance companies to pay for this thing too.
Uh-huh.
Yeah. So step one was getting approval. Step two now is trying to convince labs to actually use it.
Uh-huh. And Medicare is covering it. I don't know if that helps pave the way in any.
Yeah, no, it very well may. But I mean, the other big thing too is with this being approved now, you know, when doctors look at your immunoblot and they say, oh, that's garbage, it's not an FDA approved lab, you can now say to them, this is the same technique that was approved by the FDA in the new IDART test. So it is the same as an FDA approved method. And so that may have more standing as well too.
And that last question is, when you said those two bands are now allowed to be considered, does that mean if you get a standard ELISA Western blot through Quest, they are now incorporating those bands in their interpretation?
No, because that test kit, so each time that you commercialize a kit and you send it or that you get it approved, if you change the method in that kit, you have to go back and get FDA approval for your kit, right? So these commercial manufacturers that have been doing the standard two-step test, which has an ELISA and Western blot in it, they would have to go back and change their method and seek approval. Now, granted, they would have an easier time getting approval now that IGeneX has paved the way, but I'm not sure that we'll see them doing that.
Uh-huh. Okay, thank you so much.
Yeah. Did anyone else have any questions there? All right. So let's go next here. Let's see. Fran says hi. Hi, Fran. Move that off. All right. And this is from Emily. Let's see. Hi, Dr. Ross. I'm the one with pregnancy questions. Good. I'm glad you're here. Tested positive for Babesia and Bartonella, waiting on the Lyme test. Been in treatment for the past 4 months. Wondering about tests before pregnancy. And also, if the Lyme test is negative, should I treat for Borrelia anyway during pregnancy? Feel free to conversation with me if you have questions. Yes, I do. So, Emily, let's see where you are. If you are presentable, would you even mind showing us who you are with your camera? You don't have to, but that would be nice too.
Yeah, that's totally fine. Hi.
All right. Hi, Emily. There you are. Good.
Hello.
Nice to meet you.
I know it's nice to have an actual human forum, probably, to the voice.
Yeah. So my question is, so I know you're planning on getting pregnant, and you're wanting to make sure that you do as much as you can before pregnancy to take care of these infections, but also you want to have the best outcome for your baby too. All right. So
exactly.
Okay. All right. So let me just say a few things, and I'm going to ask you questions. Okay. So if somebody has Borrelia, we've got some data out there, not the greatest data, but it's based on pregnancy registries that were kept on the East Coast, out in Connecticut from the late 80s, early 90s. And in that registry, it wasn't a formal study, but it was information was collected from people that had Borrelia infections. And they allowed information to be collected on them. And they were looking at what happened to the mother during pregnancy and what happened to the baby after pregnancy. Okay. And so what they found is that women that were pregnant and had Lyme, if they were on antibiotics during pregnancy, the transmission rate was 0% to the baby. Okay, this is Borrelia. Okay, this is Borrelia. All right. And they found that if no antibiotics were used and the mother had active Lyme during pregnancy, that the transmission rate was 50% to the baby. Okay. All right.
That's what I've heard.
Yeah. Okay. All right. Now, I have to tell you, it's not the highest quality science, but most of us that are treating and considering pregnancy with women that have Borrelia are very much aware of that. And we usually will we recommend antibiotics, especially if you have something that looks like active Borrelia, meaning symptom wise. We will
Okay.
recommend probably being on a safe to use to the baby antibiotic during pregnancy. Okay.
Okay.
And I'll go through what those are in a minute.
Okay.
So my question is, so you said that you have testing pending on Borrelia. Is that what I understood here?
Correct. Through IGenics, they lost the test or something happened with it. So I just got redrawn for it yesterday morning.
Okay.
So I should have it soon.
2 to 3 weeks, probably. Yeah.
Yeah,
Unfortunately, I wish it was sooner
soonish.
for you, but that's
So
what
that feels like soon when you've been, yeah, of course. Yeah.
okay. So then the question, these are going to just be some questions to help me to understand clinically if I think you have Borrelia too. Okay. So just
Okay.
bear with me here. Did you get a tick bite that you're aware of at all or not?
No, the first indication of tick-borne illness was the tests. And I had basically been working with a doctor for almost a year when we included the infectious disease doctor. And I had already been diagnosed with a few other things, including Epstein-Barr reactivation.
Yeah.
And I also had a gut parasite. I had hypothyroidism and low IgG antibodies.
Okay.
So there's kind of a constellation, as there probably often is, but the first indication
Very
of
typical. Yeah.
yeah, of tick bite was getting my positive. We did the IGenics co-panel or co-infection panel
Yeah.
and came back, yeah, Babesia and Bartonella. Bartonella was like borderline, but she said
Yeah.
she considered it positive. Babesia was like definitely positive.
Okay. So, and then can you tell me where in the world do you live?
On the West Coast in Oregon.
In Oregon? Oh, what part of Oregon are you in?
In Portland.
Okay, you're in Portland. When
Yeah.
you and where have you lived in the United States then?
I have lived mostly here. However, I do have a family member that lives in the countryside in Washington State, and it is definitely tick country out there. And since I was probably 12, I've
Yeah.
gone out there a lot.
Okay.
And I also backpack and hike. Like I've been out there. I've been in the woods.
Have you spent much time down in Northern California at all by chance, like Redwoods or anything like that?
Not really Northern California. Maybe when I was growing up a little bit, like we did camp in the redwoods, things like that. So it's definitely possible.
Okay.
Outdoor family.
Yeah. So what I will say, what I'm looking for is what's your risk of having gotten
Sure.
Borrelia at the time you picked up Babesia Bartonella. That's what I'm trying to figure out here. Okay.
Right.
So on the
Totally.
East Coast, for instance, if you get a tick bite out there, in New Jersey, there's a 95% chance you're going to get Borrelia because 95% of ticks out there carry Borrelia. Okay.
Okay.
Other studies separate from that, from the East Coast, tell us that if a tick carries Borrelia out there, there is a 70% chance it will carry at least one other infection than Borrelia, and 50 to 60% chance it will carry two. All right.
Okay.
I don't have the numbers for Oregon and not Washington State. The closest we have would be Northern California, where we have studies from the redwoods that are about 15, 20 years old now that say that 70% of ticks in the redwoods, Northern California, marijuana growing areas of Northern California, that you've got Humboldt County, you know what I'm talking about.
Yep.
Those areas have about 70% of the ticks carry Borrelia, but they didn't do co-infection testing. Okay. What I will tell you is Babesia definitely is tick-borne. Bartonella, there's still controversy whether it's always tick-borne or if it isn't a infection that lives in a lot of people that gets activated when you get a tick-borne infection. I just want to let you know there's controversy there. It's not a clean-cut question. So, for instance, Monica Embers, who's one of the big researchers on Borrelia right now out of Tulane University, she's starting to say and I trust her, she's a good mind. She's got some experiments suggesting it is not transmitted. It can be carried by ticks, but it's not
Dang.
transmitted by ticks. Okay. All right.
Okay.
Okay. So let me
Yeah.
ask a question then. So if you had told me you got sick out in the East Coast, I would say definitely cover for Borrelia. There's a high chance
Okay.
because those ticks, they all run around together out there. Okay. I can't say that for sure being where you've
Okay.
been. Okay. All right.
Okay.
So let me just ask you a few questions and tease out from a symptom standpoint whether it might be. So do you have any joint pain with this at all?
I have joint pain, but I will say since I started on azithromycin and Malarone 4 months ago
Yeah.
daily, it really has been very little that I
Okay.
experienced that at all.
Okay. So when it comes to, so during pregnancy, if you have to, you can treat Babesia and Bartonella. And the have to usually is people that are screaming with symptoms and they're really sick from it. Okay.
Okay.
So you can use Mepron, which is in that Malarone that you're taking is atovaquone, which is in Mepron. And plus that Malarone has a quinine derivative that you do not want to take during pregnancy. But
Okay.
in pregnancy, if you have to, you can use Mepron, which is the atovaquone in your Malarone, and you can use azithromycin. There, it's preferable not to use those, especially the Mepron during pregnancy, but if you have to, you can. Okay.
Okay.
And then during pregnancy, on the Bartonella side, if you have raging Bartonella, you can use rifampin and you could couple it with an azithromycin, and that's if you have raging symptoms. Okay.
Okay.
The truth is, though, we don't have any studies that tell us if you are using Babesia antibiotics or using Bartonella antibiotics in pregnancy, do we prevent transmission? We just don't have the studies. All right.
Right.
So I don't mean to scare you with this, but in some ways,
No.
the drugs that you can use if you have to are a little bit riskier. There's a little bit higher risk of potential harm to the baby. Okay.
Right.
With both that rifampin and the Mepron, but you can use them if you have raging symptoms, but it would be
Okay.
more ideal if you
Yes.
can to try to deal with those infections prior to pregnancy. And that's
First.
usually what I would have my patients do. Okay. And I want to be clear, I don't have science on this one. The trouble is we don't have
I
science
know.
that
It's
says,
the Wild West.
yeah, we don't have science that says you won't get it if you're on antibiotics. We do, I'm sorry, for Babesia and Bartonella, we don't.
Right.
We
Right.
do for Borrelia, though. Okay.
Borrelia.
All right.
Okay.
All right. The other thing I want you to know, and it's kind of, if you're on Lyme United, and a lot of our members on Lyme United, I mean, it's kind of hard to believe that for most people, Babesia can be treated in 5 to 6 months, and for most people, Bartonella can be treated and cured in about 6 months as well, too. Probably, my
Okay.
opinion is about 85% of people, if you're on a good treatment, we can get rid of those infections and they're not a chronic problem in everyone. But there are 15% of people that you do wind up having chronic hard to
Okay.
treat conditions. Okay. So for
Okay.
all those reasons, what I would suggest is if you can, in your
Yeah.
pregnancy plans, if you can make room for about 6 months of trying to
Okay.
clear Babesia and Bartonella before you get pregnant, that's
Yeah.
what I usually suggest in these kind of situations
Okay.
to my patients. Okay. And then during pregnancy on the Borrelia side, because I can't tell you for sure whether you do or don't have it. I just can't.
I know.
If you get a positive test, definitely cover for it.
Obviously. Yeah, I found your videos and then there was like one other webinar that these two doctors did specifically about pregnancy and tick-borne illness. It's on YouTube and they were talking about, yeah, they were saying they don't treat usually for Babesia, but they do treat for Borrelia with 2 antibiotics versus 1.
Yeah.
And that's all the information I have. So I'm just like so grateful to get
Yeah. And
any juice from these
yeah, and I
brains.
will tell you, there's been a trend over the last few years to use 2 antibiotics for your Borrelia than 1, but I gotta tell you, I never did it that way. I always used only
Okay.
1. I used
Okay.
1, and I found I in the multiple, maybe 20 women that I helped help them with their pregnancies and trying to prevent transmission during pregnancy. So maybe 20. I mean, it's still a small
Sure,
population,
but
but
yeah.
20. I mean, there's something to that. I even using just 1 antibiotic, I never saw transmission.
Okay.
So I tend to be a 1 antibiotic person actually during pregnancy because I also believe, it's critical. And granted, you're going to be on antibiotics. You're going to be trying to prevent one bad thing, but babies' immune systems work best if they have a functioning microbiome at birth. And, you have a greater chance of having that happen with the less antibiotics used during pregnancy.
Totally.
That's kind of the viewpoint I take. And so usually if I'm going to use 1 through pregnancy, so if you're looking at maybe there's still some Bartonella around, you could consider doing azithromycin, which is going to prevent Borrelia transmission. It is one of those that's safe to take pregnancy, will prevent transmission. And you might get coverage with just it by itself on the Bartonella side.
Okay.
So if I've got a woman that there is a question of Bartonella that I don't want to do a full-on screaming Bartonella treatment during pregnancy,
Sure.
but I try to design something that might get us a little bit of coverage there.
Okay.
Then for my Borrelia antibiotic, I will choose azithromycin that I know will have some potential help on the Bartonella side.
Okay. Okay, gotcha. And then I had seen a video you did about kind of testing, the retesting question. I just got retested for the Babesia and the Bartonella in addition to the first Lyme or
Yeah,
Borrelia test.
yeah.
And so what are your thoughts about that? Like, how would I
So the
sort of
problem is,
decide that I'm more negative before getting pregnant? Is
yeah,
it symptom based or
so
okay?
here's where I'm gonna go with this one. We at this day and age do not have a done test. Okay. We don't even have a test that tells us where we are in treatment, unfortunately. Now,
Gotcha.
having said that, some of my colleagues do retests and they're looking to see if you have less reactivity on your immunoblot, which to them would
Okay.
suggest your immune system isn't working as hard, therefore we must have better germ control. I will tell you there's no validation of that at all. And in
Okay.
fact, if you look at studies about what happens with antibodies, they come and go, even when you have active
Okay.
infection. So if you get a test that looks better, that may not have anything to do with the germ load. The other thing, I'll do another flip side on that. One thing that happens when you have large amounts of germ in you, your germ load and the chemicals they release suppress the immune system. So, getting
Right.
a better test or a negative test, maybe it means your immune system isn't working as hard, but it could mean the germs are just partying on and raging in there and they've suppressed the immune system, right? So I tend to use symptoms to guide me. I know
Okay.
that not all my colleagues are there, but I disagree with a lot of my colleagues on that one because there really
That's
is. I
fair.
mean, you hear why I'm saying that, okay? Yeah.
Yeah, absolutely.
Yeah.
Absolutely. Yeah. And so if I'm hearing you correctly, if symptoms of Babesia and Bartonella are no longer happening
Yeah.
and I'm okay off of the medication and the symptoms are no longer happening, that would be the best green light
Yeah.
for
You're
okay.
probably
And
good. You're probably good to
okay.
go. Yeah. Yeah.
And then just one other clarifying question. I so deeply appreciate your time here with all of us. And just, it's such a gift that you keep offering help because there's not a lot out there, as I'm sure you know.
Well, thank you. And
If
I knew
my,
this was just too complicated to do a back and forth. I
no,
knew.
I really appreciate
Yeah.
it.
Yeah. Yeah.
My just final question was if the Borrelia test comes back negative, which may or may not mean that it's negative,
Right.
would you, from your perspective, with me having these other tick illnesses for the best possible potential outcome, would you
Yeah.
do an antibiotic anyway? Just
Yeah. Well, what I will say is it's a very individual decision. Okay.
Okay.
I'm just going to say that there's not a right or wrong
Okay.
on this. Okay. But if you're taking, you do having two, there is an increased risk that you picked up a third. And the most prevalent third is Borrelia. So
It's Borrelia.
that's just the fact. Okay.
Totally.
If you wanted to provide absolutely the best chance that your baby's not going to get something that you might have, I would do the azithromycin.
Okay.
But you have to keep in mind that, you are doing some disturbance to the microbiome that may hurt your baby.
Right.
Okay. You just got to go in knowing it's not a clean answer on that one. So
Exactly. It's always pros and cons, and especially with pregnancy. So I really appreciate your time. Thank you for answering all my complicated questions. I hope this is helpful to other people. And thank you to everyone here for letting me take up time today.
that's great. Oh, question for you, just while I got you here. So this kind of a dialogue back and forth that we just did could be really useful if other people could learn from it too.
Yeah.
As you probably know, sometimes I take my clips from these kinds of things and I turn them into an article, like your video, you and me talking. Would you be
Totally.
okay if I do that and have that on my
Yes.
treatment site? Okay.
Yes,
Because it will
absolutely.
benefit other people as well.
Well,
Too.
exactly. And that's how I've been helped from other videos. So I'm happy to have that out there.
Okay. I appreciate
Okay.
that. Yeah,
Thank
good.
you.
Yeah, good luck to you. All right. I'm gonna just see if anyone else here has any follow-up to what Emily and I just talked to, or a question. All right. All right. Let's see here. Let me move on. Hello, Sandy. Let's see. Sandy says, is methylcobalamin in supplement form effective, or is there a supplement form of B12 that is effective? I'm gluten sensitive. Okay. So with vitamin B12, which is cobalamin, and you're talking about a methylated form of cobalamin. The issue with cobalamin in general, whether it's methylcobalamin or another way it's sold, is something called hydroxycobalamin. You can sometimes find sources of that. And sometimes the more common source is something called cyanocobalamin. That's the stuff that usually gets injected by doctors, and that's cyanide cobalamin, which seems kind of foolhardy to me. But generally, if I'm going to recommend cobalamin, I'm going to do a methylated, or I'm going to do the hydroxycobalamin form. The thing with any kind of B12 is it has to be absorbed. And there are certain people that lack a protein in the that's made in the stomach called intrinsic factor. And intrinsic factor is supposed to bind to your B12 in the stomach, regardless of what form it is, methylcobalamin, hydroxycobalamin. The intrinsic factor made by your stomach is supposed to bind it, and together then they get absorbed in the small intestines, all right? There is a very, very small group of people that don't make intrinsic factor. And because of that, they have B12 deficiency. All right. So if you have never had problems with B12 deficiency, by blood testing, you probably make enough intrinsic factor that you could take it orally and get good absorption. All right. So the key thing, somewhere along the way, especially in these illnesses, usually doctors will check a B12. And so if you have some record in the past of B12s being normal, you make intrinsic factor. And therefore, the B12, whether it's methylcobalamin or hydroxycobalamin, would be effective because they would be absorbed in your stomach. Okay. Now, the reason I choose a methylcobalamin at times over a hydroxycobalamin is the methylated forms may work better at helping to do some methylation. And some people have methylation issues, and so methylation may be a bit better with methylcobalamin. But if you're a person that doesn't have a methylation issue that you would have been diagnosed with by a doctor at some point, then any one of the B12s could be fine for you. Okay, all right. So Sandy, did that answer your question for you? All right. Well, let's move on here then. Okay. Let's see. T.W. Klein. The question. Hi everyone. My stepfather, who is in his mid-70s, with Lewy body dementia that is pretty far along. He tested positive for Borrelia on an immunoblot. He was never very symptomatic as far as I know, but would you treat him in an attempt to improve the dementia? Thank you. Yeah. So, yes, I probably would, but let me have a bigger talk about this with you. Okay. So you may have heard of something called the Bredesen protocol for Alzheimer's dementia. I will try to search that with you here in a minute and show it to you. But Dr. Bredesen is a functional medicine doctor like me that usually, looks at things from what's the root cause standpoint. Okay. All right. And in his approach to Alzheimer's, which has some limited science showing benefit, he tries to look at Alzheimer's as a multi-problem issue. And he will look to see if people have mold toxins that might be underlying it. He will look and see if they have hormonal issues that might be a component. He will look and see if they have infections that might be a contributing factor. Okay. So I definitely would consider what are the things that could be affecting brain health in general. And believe it or not, it's similar to the things I do in my Ross protocol for taking care of chronic Lyme. You want to make sure you're getting sleep. You want to make sure your adrenal glands are working well, possibly support them with ashwagandha. In his protocol, he likes using something called magnesium threonate. He thinks that adding magnesium is helpful. And he will look to see if you have mold toxicity. He will look and see if you have chronic tick-borne infections. And if they're there, he will treat them. And in the studies on his effectiveness of his protocol, it appears that there's some benefit doing that. Okay. All right. So let me just do a quick screen share here with you. Oh, he'll also do mitochondria repair as part of his protocol. That's another component that he sees very helpful too. Okay. So let me do a screen share. I'm going to show you where you can find information on his protocol because I think it's a valid protocol. I've been to conferences with him before where he's presented his work and I was impressed with it. So I may spell his name wrong, but we'll eventually find it here. I think it's B-R-E-D. Yeah, there it was. Okay. So this is his book called The End of Alzheimer's. Various people will write about his protocol. So this company called Apollo Health wrote about it. But anyhow, I would take a look through here. Now, like the Alzheimer's Society of Canada says it's false hope. I disagree. I've looked at his science. It does suggest benefits from going through his protocol. Okay. So you may want to take a look at it. You may even want to see if you could find a physician that works with the Bredesen protocol. I'm sorry, my system was saying something to me. I had to look at there. But there are certain providers that will actually, functional medicine doctors that are skilled in working with the Bredesen protocol. And so you might even see if you can find one of those providers to help too. Okay. All right. So did that answer your question? Okay.
Yeah, thank you, Dr.
Yeah.
Ross. I got to change my name's Tom. It's not T.W. Klein.
Oh yeah, I know. It's amazing how these show up sometimes on Zoom, but yeah. Yeah.
I
So
wasn't
Tom,
thinking when I wrote that.
did that give you some insights then?
Absolutely, yes. He's actually he's seeing the Holtorf group in
Yeah. They'll know the Bredesen protocol down there then. Yeah.
Okay.
Yeah. I would expect, knowing the Heltork group, they'll probably be trying him on some peptide therapies as well too, because that's what they do. Some of those can be beneficial, but Bredesen doesn't. I don't think in his protocol he uses peptides specifically, but they will be the way that the Holtorf group looks at illnesses. They will be doing something similar to what Bredesen does in his protocol. Usually they do. Yeah.
Okay.
All right. Good luck.
Thank you.
Yep. Hello, Fran. Let's see. I was taking herbs and methylene blue for about a month. Then I had an allergic reaction to a probiotic. I went off my herbs for 3 days and methylene blue for 6 days. I took 3 kinds of antihistamines for about 4 days. I replaced these antihistamines with isoquercetin and seemed to be less itchy. I restarted methylene blue and noticed that I'm a bit itchier again. And I'm also noticing that I'm feeling more fatigue again. But going off methylene blue for 6 days have that much of an impact on my symptoms? How likely do you think I could have become sensitized to it? You know, I will start by saying I don't know, but then I'm, you know me, I always give a few comments then too. Methylene blue, as you know, is something we're using these days to help treat both Bartonella and Borrelia, everyone. And so it's useful at treating growing and persister forms. Methylene blue is very fat soluble. And things that are fat soluble get into the brain easily, but they also get stored away in our tissues. And they tend to have a long time to get out of our body. So even though you had days where you weren't taking the pill, the methylene blue is still in you. I'm going to just look at a drug directory here real quick to look. There's, with all medications, there is something which is called an elimination half-life, which is the amount of time it takes to get half of a drug out of you. And we recognize that to get a drug completely out of you, it takes 4 elimination half-lives. And I'm just looking up to see what it is on methylene blue.
Well, does the color of my urine indicate if it's out? I would
No,
think
not necessarily, because the color maybe to a degree, but remember we're talking about what's in your tissue still, and and the methylene blue that you're peeing out is more the free methylene blue in your blood that gets into the kidneys. Then basically, are you still peeing out a blue color?
I stopped. It was clear again, and I just when I started, it's slowly becoming again. Yes.
Oh, okay. So the half-life, it's long, but it's not as long as I thought it was going to be. It's 24 hours, which means that within 4 days of stopping it, it should be out of your system entirely. Which it appears you had at least 4 days off of it. Is that?
Yeah.
For 6 days. Yeah, 6 days. Yeah, so it should have been out of your system. And the reason I was trying to get at that is I was trying to look at whether it might have been in your system all along, and therefore I doubt that it suddenly started, causing allergy or mast cell symptoms.
Well, I'm just so the reaction I had written to you online. I took the oh my gosh, the spore-based megaspore biotic.
Yeah.
And I ramped it up way too fast, not really realizing.
Yeah.
I took a half a capsule the first day, 1 capsule the second day, then 2 caps and 2 caps. And by the end, and like my symptoms were they were slow in coming. Like first my ears and my jawline were itchy. The next day, my legs were itchy. The next day I broke out in hives on my, my whole torso. So anyway, I'm just wondering if, going off of those 3 major antihistamines and replacing it with the isoquercetin is maybe why I'm feeling itchy now.
Yeah.
Because
remind me again, I'm just trying. So were you on the antihistamines before you stopped these medications then?
I was taking, actually, I was just on Zyrtec at night before I had this allergic reaction.
Okay. And why were you doing Zyrtec at night? Was it just for regular allergies, or were you
No,
already
it was just regular. I had some chest tightness and my PCP said she thought I had was having an allergic reaction. She wanted me to take a Zyrtec at night. So I did that. I was doing that.
And are you back on the Zyrtec now?
Well, you know what? I stopped because I was sick and tired of taking all of this stuff. I have started Zyrtec again. Last night I started it because I'm finding myself that I'm itchy again.
Yeah. And here's why I'm asking that is, it's possible, with mold toxicity, with chronic tick-borne infections, too many yeast in your intestines, these are all things that can stimulate your mast cells to be overly reactive. And it's very possible that maybe you, underlying all of this, you have had some mast cell activation that was being not apparent to you because you were also taking Zyrtec at nighttime. Okay. And so clearly your mast cells had a fit on that megaspore. But I'm
Yep.
wondering, given how much of a reaction you had, if you already had overactive mast cells anyhow, and the reason you may not have been experiencing as much problem like some people with really reactive mast cells can, is you're already taking one of the medicines that manages it by the Zyrtec that you were on before. Do
But
you
I wasn't taking that for very long before that.
But you were still on it though.
Mm.
But how long were you on it before?
Probably a few weeks.
Okay.
It wasn't very long. And I've never been an allergic person. I've never had an allergic reaction before in my life. So
yeah, so clearly your system has been really your mast cells have been triggered by the megaspore. And in a sense, their thermostat has been reset. Okay. Now, that's not to say it won't be set back down again, but right now you have reactive ones. At times, killing germs can also trigger your mast cells to get more active as well, too, which could be why you're feeling worse back on the methylene blue again in terms of some of those mast cell symptoms. I take a look at my article on mast cell activation. I think I shared that with you. All right. But in there, I talk about a kind of a layered approach to control the mast cell reactivity. One of those is being on a mast cell stabilizer like the quercetin. Okay. But the other thing is, if you are still symptomatic with that, then you want to work with two different layers, potentially two different layers of antihistamines. One is the kind of allergy antihistamines like a Zyrtec. All right. But also then some of the acid blocker medicines that we use in our stomachs, also some of those have antihistamine properties too. And so if I were treating you, where I would go, first of all, is I would maximize the quercetin. I would probably get up to 500 milligrams 3 times a day. I would get back on that Zyrtec at 10 milligrams a day and see how you do with that. If that's not enough, look into one of the acid blockers that I write about in my mast cell article and see. You're just trying to blunt the reactivity. Eventually that should calm back down. But I would, that's what I would do on the mast cell side. The methylene blue, is the amount of fatigue you're having with the methylene blue now and the itchiness on the methylene blue bearable, or is it bad?
no, it's totally bearable. And you know, I was on such a good trend before I had this total event.
Yeah.
It threw me for a loop, completely threw me for a loop. So I was taking so many other supplements as well. I stopped taking everything.
Yeah.
So no, it's totally bearable. And my doctor told me to take Benadryl, Zyrtec, and Pepcid AC. And of all the three, my ears were itching one day. I took Pepcid AC and they stopped immediately.
There you go. So your provider is telling you a similar approach to what I'm saying. So the Benadryl is an old line H1 blocker antihistamine. The Zyrtec is a newer H1 antihistamine blocker that they both are working on the same site. However, the old time ones are stronger, like Benadryl, but they have more sedation with them. And the Zyrtec can work, but sometimes not quite as strongly as the old time. That's probably why your doc had you go for both of them, actually. Yeah. And I was going to say, talk to your doc, but you've already talked to your doc. Yeah. I would think I would just try to manage the mast cell and see if you can stay on that methylene blue if it's tolerable for you while you wait for those mast cells to calm down. They're going to calm back down again. It's just that they got really clobbered with that megaspore. And, you know, I have a rule in medicine. Anything can happen to anyone with anything. I have to tell you, I've never seen somebody, and I've used quite a bit of megaspore and spore-forming probiotics in my practice. I never saw somebody with that severe of a reaction. But anything can happen to anyone with anything. So, yeah.
Well, you know, the thing is, too, is I was taking so many other supplements and I was fine on everything else. I don't know if this just didn't mix well with all of the other things I was taking. I don't know.
It's hard to say. It's really
It
hard to say. Yeah. Yeah.
But it's okay for me to stay on the quercetin and the Zyrtec while I'm taking this stuff for Bartonella. Okay.
Absolutely. Absolutely. Yeah.
Well, thank you, doctor.
You're welcome. Good luck to you.
Thanks.
All right. Does anyone else have any questions about what Fran was talking about there? Okay. Okay, Sandy wants to know, did I learn about any new herbals for Bartonella that I learned at iLads? The answer is no. But if you want to see a table where I look at all the science that's been done recently out of Johns Hopkins University that list out herbals that you can use and potential benefit for Borrelia, Babesia, and Bartonella, I've got it all on a table. And so, unless, in case you're not familiar with that, I'm just going to do a quick screen share and show it to you here. So if you go to my Treat Lyme site, and there is an article called Best Herbal Antibiotics for Lyme, Bartonella, and Babesia. If you scroll down here, I've looked at all the recent studies that have been done and created this table. All right. And so for Bartonella, cinnamon, as in my cinnamon clove oregano, works on growing and persister. Cryptolepis, growing and persister. Eugene clove oil, growing and persister. Black walnut, growing and persister. Oregano, growing and persister. And Japanese knotweed works on growing and persister. Okay. And I think many of you know I've been recommending a number of these, like my liposomal cinnamon clove oregano, the Cryptolepis I've been recommending, and the Japanese knotweed I've been recommending as well too. I haven't really been doing black walnut in my practice. I didn't do it, nor I've been recommending it much on the site, but I think that's a reasonable thing to consider doing too. All right, let's see. Sandy, I'm sorry I don't have any new insights for you there other than that table. I hope that gave you some ideas though.
Yes, I was just wanting to rotate some herbs since I've been on some for about 6 months.
Yeah.
I've been on crypto, Sita, Kuda, Hootenea, Panella, Berber.
Yeah.
And I was just wanting to rotate.
Hold on just a minute. I've got a friend of mine's come over to walk my dog and I was just getting disturbed there. so I just walled off my dog from wandering in here. So, okay. So you said crypto, Hootenea, and what else again?
Sita, Kuda.
Okay.
And Panella, Berber.
Okay. All right.
And yeah, I haven't tried black walnut. I was just wanting to rotate so that I don't get, my bugs don't get too used to what I've got.
So I would look at, if you wanted to rotate, you could look at a Japanese knotweed.
Oh, yes, that's what I'm taking also.
Oh, you are? Okay.
Yeah.
The other thing, well, you could look at doing a black walnut, Hugland's nigra, along with a liposomal cinnamon clove oregano, because within that you've got 3 volatile oils that can work on the Bartonella, and then also the Japanese or the black walnut has evidence also against Bartonella too.
What about the Chinese skullcap? Does that work for Bartonella?
I don't think it does. At least the information, what that table I created is based on research that's been published over the last 4 years, predominantly a bunch of independent studies that were done out of Johns Hopkins University. And I have not seen anything that says skull cap for Bartonella out of that.
Okay. All right. Thank you. Thank you very much. And thank you for all you do.
You're welcome.
And thank you for offering all the herbals.
Oh, you're welcome.
That you do on your site.
Thank you.
Yeah.
Thank you. I like that. I like the Montana Pharmacy Company. they're good people too. I mean, they're actually good people as I talk with them and talk with them about where they're sourcing their products from as well too. So they're good. It's always good when you have people putting good energy into their products as well too. So yeah, thank you.
Yeah, I can tell they've helped, but
Yeah.
I'm just wondering if I ought to be rotating.
Yeah.
All right. Thank you.
Yeah. Good luck. Mhm.
Thanks.
Let's see here, Colleen. Let's see. When we do the prolonged fast, should we continue taking our supplements like acetyl-L-carnitine, ferrosorb D3K2, curcumin phytosome, and magnesium citrate or magnesium carbonate? So, the thing, we've had some, and it's a good question. And actually, I probably need to add a section to the article that I have about the fasting mimicking diet offered by Prolon. So the idea with that Prolon fasting mimicking diet is that you have a diet that has a preset amount of calories that you take each day with a specific amount of amino acids, fats, and carbohydrates. And it's designed in a way to give you minimal nutrition, but not trigger your fasting or your nutrient sensing pathways so that your body is in a fasting state. And in the fasting state, what you get out of that is you trigger a process called autophagy, where each of your cells that have damaged parts due to having chronic infection, age, etc., it'll trigger autophagy where they recycle these parts. The other big benefit is as you get to clear out what are known as senescent cells. Senescent cells are cells in your body that when you have a lot of oxidation agents in your body from having chronic infection, your cells go into what's called senescence. A lot of your cells may go into senescence. And a senescent cell essentially stops growing and dividing, but it's kind of a zombie cell. And in its zombie state, it spits out tons of inflammation chemicals. So like cytokines. So it could be why you feel badly still, even though you may have knocked down a lot of your germs. Okay. So anything we can do to trigger more autophagy and removal of senolytic cells could be helpful for people living with chronic Lyme. The prolonged fast, this fast mimicking diet that you do 5 days, is one way of triggering it. There's also some supplements you can take that trigger autophagy and trigger that have senolytic effect. And just a heads up, I'm in the process of putting that article together for you all. And sometime early next week, I anticipate having an article that will bring together some concepts we now do in anti-aging medicine regarding some things like this that could be helpful for people living with Lyme. And some of those are using senolytics. Some of those are using things that induce autophagy, including a fasting mimicking diet. Okay. So in choosing your supplements, you want to use supplements that will not be interpreted as being food. All right. And so you want to avoid using supplements that have fat in them. So if your D3K2 is in fat, and it probably is, it's probably in olive oil, I would probably avoid doing that. Ferrosorb itself is not going to trigger nutrient, nor with the preparation of that, trigger your nutrient sensing pathways. Acetyl-L-carnitine by itself, and even the kind of fillers they may put in that pill would not trigger it. So I think those are okay. The curcumin phytosome it's a liposomal product, meaning it has fat droplets into which the curcumin is placed, may trigger those nutrient sensing pathways. So anything that is liposomal, including liposomal glutathione, I would probably hold on. Your magnesium citramate and magnesium carbonate should be okay. They're not, again, they don't have fat in them, they don't have protein in them, and they don't have carbohydrate in them, basically. Okay. So the two things I'm suggesting you hold would be the curcumin phytosome, because the phytosome is liposomal, meaning fat-based, and your D3 and K usually are going to be an olive oil or some kind of an oil. And so I would probably try to avoid that during the fast as well, too. Okay. All right. And then most prescription medicines generally would be okay to take as long, again, as they're not fat-based or in fat. All right. All right. Colleen, did that answer your question for you?
Yeah, I had one more question. What
Sure.
about psyllium husk?
The psyllium is not, it's a non-absorbable fiber. It's not going to be absorbed into your body. So you should be okay with that.
Okay, thank you so much.
All right. And so for everyone who's wondering what I'm talking about with this fasting mimicking diet and where do you get it, let me just do a quick screen share here for you. So I got the idea about the fasting mimicking diet years ago, actually. A patient of mine had gotten like 80% better with all of her chronic Lyme symptoms and was just stuck. And she started doing 5-day fast. And it was the thing that got her 100% well. Okay. So one way to do it without fasting completely is this fasting mimicking diet. And I have a whole article on it. It's called Revitalize Your Health with a Fasting Mimicking Diet and Chronic Tick-borne Infections and Mold Toxicity. And in here, I talk about it doing a lot of things, including rejuvenating your cells, etc. But the two big things are this autophagy that it creates, and then also getting rid of these senolytic cells. All right. And then if you want to get it, I actually have a special code from the company that gives you a discount that you cannot get unless you go through a provider. So you would click on the Start Now button here, which brings you over to my store, and then you would click on the Shop Prolon 5-day. And this, oops, that's actually my my administrative page. But if you click on this, it'll bring you to the Prolon site, and you get a discount that's about a 20% off code over what you could get if you went there directly. Okay, all right. And that's what they look like. It's basically you get a box for each day, and it has roughly about this. There's a little bit more food than this, but enough food so that you get a lunch, a dinner, and a breakfast, but you're eating about 700 to 800 calories a day, roughly. Okay, all right. All right, let's see here. Let's see, Sylvia. Let's see. On a recent test, my CD57 cell was 39. Additionally, T cells, CD3 absolute are 862, 900 being the low end. Everything else was normal, but on the low end of the spectrum. My naturopath has been recommending low-dose immunotherapy for a while. I would rather support cellular immunity with supplements first. What are your thoughts on LDI now? I've ordered transfer factor multi-immune, omega-3s, CoQ10, quercetin, vitamin E, selenium, zinc, already on selenium, zinc, mushroom blend, vitamin C, and NT factor or ATP fuel, or are they similar to transfer factors? I also have a stash of 3-week azithromycin and wonder if taking it with atovaquone will make a difference or just rock the boat in a bad way. I have 3 Bs still IgA positive for chlamydia pneumoniae, even after a month of antibiotics in July. Also, will eye drops with doxycycline help ptosis symptoms? Okay, that's a lot of questions. Let me try to go through this here. So basically, these tests that you've had, CD57 is a very specific type of natural killer cell. Usually we consider about 100, maybe 125 or higher to be normal. So this is a type of cell that fights infections. It can be low about 80% of the time in Lyme, but also virus infections in general can cause it to be low. So at one time, many doctors were using it to diagnose Lyme, but actually it's not diagnostic of Lyme. It's just something we see with virus infections that you get suppression of this type of what's called a natural killer cell, all right? A CD3 is another type of cell that should be elevated if you have functioning cellular immunity, all right? So when we talk about immune function, there's some things that there's some terms you use, and I'm going to try to describe them to you. So you probably have heard that something called Th1 inflammation. You probably have heard something called Th2, and you might have heard of something called Th17, and you might have heard of something called T regulatory cells. Let me explain all this, okay? So Th1 is what is known as cellular immunity. These are the cells that fight infections, all right? Either fight viruses or tick-borne infections. These are T cells, natural killer cells. And what I can tell you by your killer cells, by the CD57 and your CD3 counts being low, your Th1 is not functioning as well as it should. It's low. Okay, so you have low Th1. This gives me some clue that you have low Th1. All right. Th2 is made up of your antibody cells and also of your mast cells. And often if Th1 is down, that means you got too much Th2. You might even be having some mast cell activation symptoms, for instance, okay? And if you can get Th2 down, often that's going to bring up Th1, all right? All right. Then you've got these things called Th17. Th17 is made up of cells that sit just under your skin or your mucous membranes. They're immune cells that we call the front line of your body's defenses. They basically try to attack foreigners that your body has never seen before. All right. So germs that are new to you, like when COVID was new to you, it would have been the Th17 cells that tried the immune related cells that tried to attack it. Okay. All right. Now, overseeing this soup of Th1, Th2, and Th17, the parent in the room that makes sure these kids are behaving correctly and acting the right way are called T regulatory cells. So one way to get your Th1 working better and get more action is to get your T regulatory cells working better, okay? And there's two ways you can do that. One, you could see if your practitioner will work with something called low-dose naltrexone, not LDI, but low-dose naltrexone. Naltrexone is a narcotic blocker. When we use it at very, very low doses, it can trigger a stronger T regulatory cell response, okay? The other way to get at increasing Treg action is to use a peptide product made by Integrative Peptides, which is called Thymogen alpha-1, all right? I'm going to show you an article in a minute where I have both the LDN and this Thymogen alpha-1. But if you're looking for a way of getting better balance here, because I can already tell you got too little Th1 to fight infections, I would either do the LDN or I would do Thymogen alpha-1, 1 pill twice a day. You could even do both. I don't think you need to do both, but you could. Okay. All right. In terms of low dose immunotherapy, I got to tell you, I know this was quite the rage a number of years ago. I think it has gradually fallen out of disfavor for most of us, and I've stopped using it altogether. I just didn't see good results from it. So I tend not to be a believer in that. Okay. In terms of NT factor and ATP fuel, they're different than transfer factor. So this transfer factor multi-immune is going to help boost up your natural killer cells, but it's probably not going to boost up all of your Th1. It could help, but if you get on the Thymogen alpha-1, I don't think you necessarily need to be on the transfer multi-immune. The reason to use an NT factor or an ATP fuel or an ATP 360 is if you're also wanting to do some repair work on your cell energy factories called mitochondria. Okay. All right. And then let's see. So if you're trying to get rid of Babesia, atovaquone alone will not do it all the way. So if you have azithromycin, a better treatment would be to do that combination of azithromycin and atovaquone. And then I do not think that doxycycline drops will help the ptosis because you're just putting doxycycline in your eye. Your ptosis, which is your dropping eyelid, is going to be caused by neuromuscular dysfunction of the nerve that makes this work. And that nerve starts all the way in the back of the brainstem. So the drops here are not going to do anything to help the function there, basically. Okay. All right. Now, let me just do a quick screen share here for you. All right. So take a look. So let's see here. I'm just going to type in Thymogen. There it is, actually. Okay. So this article called Boost Tregs to Balance Th1, Th2, and Th17 basically describes what I was just telling you. Okay. And in here, I've got the Thymogen Alpha 1 and also LDN that are recommended as well too, okay? And for more information about low-dose naltrexone, you can click on this article. And for more information about peptides in general, including this Thymogen Alpha 1 product, you could click on this, okay? And then in terms of where can you get the Thymogen Alpha 1, like Harriet, along with the other peptide products from Integrated Peptides, and this is that product. Again, it's 1 pill twice a day, okay? All right. So Sylvia, that was a lot of questions there. Did I answer them well enough for you? Do you have any follow-up questions?
Yes, that was great. Thank you very much.
All right. Good luck to you.
Thank you.
You're welcome. Hello, Meg. Let's see. Meg says, I had my adrenals tested. My cortisol levels are normal in the AM and then tank, and my DHA EA is extremely low. How would you treat this? I'm currently treating BART, Borrelia, and possibly Babesia. I would work first by trying to support adrenal function. And if you are not on an adrenal adaptogen yet, I would get on one. So my favorite adrenal adaptogen, something that helps the adrenals work better, is ashwagandha. Other ones that and usually I'll use ashwagandha 400, it comes as a 400 to 500 milligram pill, depending on your brand. Do a couple pills in the morning, and I would do a couple pills between 1 and 2 in the afternoon. Its effect is longer acting in terms of an adaptogen, but the trouble is if you take it too late in the afternoon, sometimes it stimulates people too much and they'll be up at night, okay? So if you're not on ashwagandha, that's where I would start. If you are already on ashwagandha and you're still having something like this, I might look at using a product that would have ground up adrenal gland in it. And adrenal gland, and you might even look at possibly using rhodiola as another way to do it too. Okay. Meg, did that hit?
Quick question. Fallon recommended Adrenalive.
Yeah, that could be fine too. That probably, I don't know the specific product, but I can tell you about the name. It probably has some adaptogens in it as well too.
I have it right here.
What's
CB6, pantothenic acid, adrenal gland, Asian ginseng, licorice, rhodiola.
Yeah, there you go. So it's a glandular, it's got ground up adrenal gland. Got a few nutrients in there, but that rhodiola and ginseng would be your adaptogens that are part of that as well too.
Okay, and dosing on this, 1 to 2 pills twice a day.
Yeah, that's what I would do with that.
And really quickly, the DHEA level is 19. The range is 106 to 300.
Yeah, that's a little. Are you doing any DHEA too at all or not? You might look at, you can get DHEA in 5 or 25 milligram pills. This is a hard question because sometimes just getting on the glandular adaptogen mix will kick your DHEA up too. I would probably start there first. I would probably start there. Yeah.
Thank you. Nice to see you again, by the way. It's been a while.
You too, Meg. You take care.
Take care. Bye-bye.
Bye-bye. All right. Diane says, thank you for your helpful answer to my written question to treat or not to treat. As a follow-up to that, with the hopes of eradication, do you think I don't go the herbal antimicrobial route? I would run the likely risk of the triple Bs resurfacing later in life. And do you recommend taking the Thymogen Alpha 1 either way? So the Thymogen Alpha 1, if you're trying to get your immune system balanced to help fight the battle, yes, I would recommend that, Diane. And then, in terms of relative success of prescriptions versus herbal, I'm running out of time here right now because we're at 7:29. I'm going to show you an article. What I will say briefly is herbals can work as well for Borrelia. Herbal antibiotics work slightly less for Babesia and slightly less effective for Bartonella. But I have it all in an article where it's a video article that you can look at, and I would suggest looking at that for you, okay? And then let me do a screen share and show it to you here. Let's see. I gotta figure out where I put that. Hold on a minute here. Oh, here it is. This article called Recovery Chances and Timelines with Herbal versus Prescription Antibiotics. It's got some words, but the key to the article is this video that I created here. Okay. All right. So I would take a look at that. I think you'll get answers to that question for you. Diane, did you have any other comments?
Sorry. Yeah, I just was wondering if and thank you, I know it's late. If I didn't, because my symptoms right now are fairly decent.
Yeah.
So if I didn't treat for the 3 Bs, I was the one who had that heart block like 2 months ago, and now it's gone. So if I don't treat, then that's probably, I mean, just with the antimicrobials, then that's probably not a good idea, right? Because then it might come back, like I might down the road.
So we don't know.
Yeah.
That's what I was trying to say earlier. I may have not said it clear enough because I wrote you the response earlier about this, but underlying it is we don't know what % of people with mild symptoms become raging someday, or will immune support primarily that I wrote you about today be enough to get your immune system kicked on to take care of it and not have to bother. We just don't have any long-term studies on that.
Okay. So, thank you. That gives me food for thought. I really appreciate it. You're wonderful. Thank you for everything you do.
You're welcome. Thank you. All right.
Take care.
All right, everyone. That is it for me for tonight. It's been good being with you here, and come back again next week. We'll be doing another one of these next week again. Okay. All right. And then tomorrow morning, look for the recording somewhere probably around 9:30 in the morning. I'll have it posted up in the Zoom recording section at Lyme United, and it will have a brief summary associated with it too. Okay. All right. Good night, everyone.